perhaps a little bit of a frame of where a little bit of history maybe of where the method comes from, you know, like to give a frame to.
Okay, okay, all right. We can do this, indeed. Well, Vincent. Well, you know, in my CV, you will see that I'm involved in club foot since a very long time. As I started with pediatric orthopedic surgery in around the end of 1961, a long time ago. And I was a junior resident, no, senior resident at that time, and then I became a fellow in the same department, the same hospital, which was an old hospital named Hôpital Bretonneau. It is in the 18th borough in Paris, in north of Paris, and there was a very nice department of pediatric surgery by that time, as pediatric orthopedic surgery was not so much individualized, and then we had to be involved and to learn as well pediatric surgery as pediatric orthopedics. You see, okay. So that some years later, as I became assistant in the department, I was then involved only in orthopedics, orthopedic surgery. Well, about this technique of treatment of the club foot, which is the name is fonctionnelle method, and or now it is said Bensahel method. As I started in pediatric orthopedics in the Bretonneau hospital, there was a method before, and this method was focused indeed on the a kind of physical therapy, but the physical therapy which was performed by that time had nothing to do with our current method, and because by that time in 1950 there was two methods, at least for the conservative treatment, the conservative part of the treatment of the club foot. It was the plaster cast, serial plaster cast, and the physical therapy. Because physical therapy was just founded and created. You see, it was the onset of physical therapy in children at least, and it was not so much developed, so that the aim of physical therapy, of that kind of physical therapy, which was made between the 1950 and the time I started with my method, was to prepare the foot, the club foot, for surgery. You see, it was not to treat the club foot and to reduce completely the club foot, but just to prepare it to surgery. And second issue about it is that that kind of physical therapy was not so nice for the children, because it was thought by that time that to be efficient physical therapy method should be strong and making stretch, even if the child and the baby, for instance, did cry. You see, if he cries, that means that we are efficient. You see, that is it was important, when I came, I considered that I disagreed with such a method, and I thought that we could do perhaps better, in a better way, so that the physical therapy would be made and performed with the agreement of the baby. That is to say, he was no more crying,
yes.
You see, and progressively also. And the second aim, much more important, was my ultimate motive was to try to that the physical therapy can perhaps avoid to have to perform surgery. You see, that's the main aim was try to avoid surgery, and the second mean and the second way was that to have the agreement, unconscious agreement, but agreement of the child, as he was no more crying, and we had not to fight with him to try to reduce the deformities. That is the global aim, and I started progressively, and the method was on the end. The technique was on its end in 1972, and we could start with it with the team of physical therapy, which was made some other former physical therapists in the department of orthopedy. So well, that is the summary, brief summary about the method.
Yes.
See?
So the research part was several years long.
Yes. I didn't want to start too early. I didn't want to start with the method before it was completely well made, well done, and completely well thought about it, in the different ways of it, and the different ways of our and the stages of the physical therapy. And okay. Afterward, well, of course, since 1972, we made some modification, but it was slight modification, but the principle, the rule and guideline of the method is, I can say, the same as 35 years ago.
Okay.
You see, some what differed progressively was the kind of splint. You see, for instance, this splint, the ski, was already since the origin, the onset. You
yes.
see, but the splint before the age of the upright position, we more progressively we modified the splint so that it can become lighter and much more flexible and below the knee splint, so that the baby can move as usual for and the physiology of the foot and ankle and lower limb also. See? Let's come now to the question you would like to ask me